Good evening, ladies and gentlemen. Welcome again to 103 FM's Men's Health Clip Hour. I'm your host, Dennis Webster, and joining me again in the studio is medical doctor and attorney, the eminent Dr. Flavio Cardone.
And hello again, Trinidad, this evening.
I would like to start off the show as usual by always reminding you to seek the advice of a physician or other qualified healthcare provider if you have questions regarding your medical condition, and that you never disregard professional medical advice or delay in seeking it because of something you've heard on this show. Now, Dr. Cardone and I have done, I think this is show number 7, Dr. Cardone. And we've covered quite a few topics, prostate cancer, non-cancerous enlargement of the prostate. We've also covered erectile dysfunction, as well as medical malpractice. Now, Dr. Cardone, this is an area of specialty for him. He's been, because being a medical doctor and attorney, he's had quite a bit of experience in medical malpractice.
Yes, as an attorney, not as a doctor taken to court.
Right. He's done no jail time. Dr. Cardone, I'd like to start off by reviewing a couple of things and maybe getting your reinforcement on a few things. One being this, the PSA test. So we've basically said that doing this total PSA test that I guess that many physicians are still doing as a risk assessment, as a screening tool for prostate cancer is not according to current guidelines.
Yes, the PSA should not be used for screening. PSA can be used as a part of a whole risk assessment calculation, but not alone as a screening tool.
Now, this is a little bit confusing, I still think, for people. So basically what used to be done was this PSA blood test. Now, that's called a total PSA blood test. And that would normally be combined with something called a digital rectal examination, or what people commonly refer to as a finger check. Today, they're not doing that anymore. We're basically doing something called prostate cancer risk assessment. So where you would use only the 2 bits of information before, which is the total PSA and the DRE, now we're using at least 6 or 7 more bits of information to basically find the men who are at risk for the aggressive form of the disease. Now, we don't want to treat all prostate cancer, because not all prostate cancer will cause a man a problem in his lifetime. So we're trying to focus on the more aggressive types.
Yes.
And this is what we do with risk assessment. Now, there are a couple risk assessment formulas out there. I think one is put out by the University of Texas, and another one is available at the Sunnybrook Hospital in Toronto, Canada, the one that I'm actually more familiar with. Now, BPH, Dr. Cardone, some of the symptoms can mimic advanced prostate cancer, the urinary symptoms, but usually if the prostate cancer is an advanced stage. Is that correct?
Well, benign prostate hyperplasia, which is BPH, is a condition when your prostate is just enlarged, and as the name says, is benign. It's just a large prostate. The symptoms can be also those of an infection.
Right.
There can be blood in the urine, but let's say the main symptom is an impaired blood flow. Urine flow,
right,
which and terminal dribbling especially.
Right.
Sometimes people can have very serious problems because of that, such as urine retention or hydronephrosis, which is in a way the urine.
It's backing up.
Yes, going back to the kidneys and making them swollen, in which case an operation is needed right away.
Now, approximately 1/3, according to my research, 1/3 of all men will start experiencing symptoms of BPH by age 50. So you can expect to get some sort of symptoms by age 50. The majority of men will. Some men will have an enlarged prostate but will have no symptoms. So if you're getting up a lot at night, if you find that your urinary stream is somehow interrupted, if you feel that when you go to pass your urine, your bladder doesn't totally feel completely emptied, then you could be experiencing symptoms of BPH. And the best thing to do is to get it checked sooner rather than later.
Yes, although I would say it depends on, just don't take these symptoms for BPH, because they could be also a result of behavior, like drinking too much water at night or sleeping in a very cold room. So, but of course you should talk about that to the doctor, who should ask you whether you have been drinking too much water, whether you're taking medication that causes you to be passing out more urine, and things like that.
Right. Now, so there are some lifestyle changes you can make before you actually try medication to try and sort of resolve some of the symptoms related to an enlarged prostate.
Yes, because sometimes the symptoms disappear on their own.
Right.
So, for instance, there are some changes, like, for men, passing urine sitting down sometimes already starts to resolve the symptoms, and in many cases the symptoms persist for 1 or 2 years and then they regress with no consequence.
Right. What about this thing, prostatitis, Dr. Cardone? I understand there are two types of it, and it can be a worrisome thing for a man to deal with.
Prostatitis is an inflammation of the prostate, and as such it can develop into a big urinary infection and cause further problems. And in men, always urinary infections take a longer time to cure. Right.
Now, there's some testing. If you're having issues and it's related to an enlarged prostate, you can expect certain testing to be done, and there are some things you can do to actually help your doctor. And I mentioned this, I think, in the first or second program, the International Prostate Symptom Score, and it's a simple questionnaire that asks you how you pass your urine, if there's any interruption in your stream, if you find you're unable to hold your urine, if you have to pass urine, it's urgent, you can't hold it, symptoms like that. And some of the testing that's done, one test is called a Euroflow testing. So the doctor will get you to pass urine into a special machine that actually measures the speed of the urine stream. And when that's done, they will do a scan of your bladder to see how well you've emptied your bladder. Because sometimes men have issues emptying their bladder completely, and urine that stays behind and stagnates can actually contribute to a urinary tract infection. So you want to make sure that you empty your bladder as well as possible.
Yes, of course, this is also very important. And as I said, in men, urinary tract infections are much more complicated than in women.
Right. Women apparently have shorter urinary tracts.
Yes, of course.
Right.
And they don't have a prostate.
Which is good, yeah. Well, actually, that's a good point, because actually I was in one of the other islands, and a woman actually asked me that, whether women have. So not all women are aware that only men have prostates, so you don't have to worry about prostate and prostate cancer. We also covered a bit about medical malpractice. Can you give us a little a summary on basically some of the main points of that people should basically consider and pay attention to?
Well, we spoke a lot on medical malpractice, but I would say that the important thing to realize is that it's not as what is seen on television, that especially they have some ads that if you have taken this medicine, you may be entitled to compensation.
Millions of dollars.
Yes, well, you may be, anything is possible, but really it's not like that. It has to be proven that the doctor was negligent and that it caused some actual damage to you.
So what can people do, Dr. Cardone, basically, are there any general steps they can take to help prevent them from being like victims of medical malpractice?
Well, that's very difficult, because people have to trust their doctor, and people are not doctors, so they don't know what is actually going on, whether the decision taken is a good one or not. what they can do, a good thing is to have copies of everything always.
Right.
Get a copy of the medical history, and also try to get a second opinion if there is any doubt. Do not be afraid to ask somebody else about their case. In fact, also checking the reaction of the doctor when talking about a second opinion, because a good doctor will welcome the second opinion, whether a bad doctor will react in some way that will show that he's not pleased that the patient is getting a second opinion.
Right, right. And you're entitled to, second or third if you want.
Yes, as many as you want.
That's your right. Lovely. You're listening to 103 FM's Men's Health Clip Hour. There are three ways to be part of the show. The first one is to give us a call at 628-4103. You also have the option to log on at 103fm.net, or you can choose to send us a text. You can do so at 4103. I'm in the studio today with Dr. Flavio Cardone, the eminent Dr. Flavio Cardone, who is both a medical doctor as well as an attorney. And Dr. Cardone, it's been great having you on the show. You've been giving us great input. With regard to sexual health, I think we covered that also. And, in Trinidad we have a large number of, hypertensives and diabetics. Is there any recommendations, for them with regard to addressing?
Especially diabetes can cause problems with erectile dysfunction, and people and men should be especially careful with that, because diabetes can destroy the nerve endings, and once those are destroyed, they don't come back. So they lose the erectile function, and it's lost. It's not going to come back. And so what I would say is that people should really, watch their diabetes and should actually take the proper medicine for diabetes and not...
And how often, Dr. Cardone, should they be actually checking their blood sugars? And
Well, it depends on the kind of diabetes, because people who take insulin, they check it once a day at least.
So the type 2 diabetics, it was important to take it probably first thing in the morning?
No, it depends. It depends how advanced the diabetes is. In some cases, they don't have to measure it all the time. If they're just taking metformin, then they will just measure the blood tests whenever the doctor... They don't need to have a machine at home to measure their blood test. That's only for people taking insulin.
Ah, I see. So the type 2 diabetics, they shouldn't be actually monitoring their blood sugars?
No, again, it depends on the severity of the diabetes in the type 2 diabetics. If they are taking insulin, then yes, they should monitor the sugar every day. If they're not taking insulin, then there's no point in measuring the sugar every day.
Wonderful, wonderful. So you're listening to 103 FM's Men's Health Clip Hour. I'm Dennis Webster, your host this evening, with Dr. Flavio Cardone. And, excuse me, we're basically covering some of the topics that we covered over the past 6 shows. Basically with a focus on men's health. If you have any questions for Dr. Cardone, please feel free to call in to us at 628-4103, or log on to us at 103fm.net, or you can choose to send us a text. It shows about men's health, and we're here to provide as much information as we can to you to help you along. Please keep in mind we don't make medical diagnoses, and so we can answer general questions only. Dr. Cardone, standards of care. We talked about continuing medical education and the importance of that, and we had a brief discussion, and we basically feel that in theory it looks like it's being promoted, but there's no check system, there's no, how do we make this work?
Yes, in some countries doctors have to pass exams once in a while to stay as doctors, have to show that they studied a certain amount of time every every so often.
Right.
And unless they do that here, there will be no way of
changing the system at all, right?
Yes, if they don't have to show that they're actually
We have a call on the line. Yes, good evening. You're at 103 FM's Men's Healthcare Power. You have a question?
Hello?
Hello, can you?
Yeah, good evening.
Good evening.
What happened is that a long time ago, I did a test on the PSA, I did prostate, and the 30% was about 2. Is that good or bad?
What did it say, sir?
Reading out now on it.
Oh, the result was 2. Well, it's a good question because we talked a lot about this. The test that doctors normally send men for is called a total PSA test. And to understand total PSA test, you have to understand PSA. So PSA is produced by the prostate. The function of PSA is called prostate-specific antigen, is basically to liquefy semen. So it makes it easier for sperm to swim. Problem with the total PSA test, which is what doctors generally send men for, is that there are 2 types of PSA in your bloodstream. One is called free PSA, one is called bound PSA. When you add the 2, you get this result that the doctors normally send you for. But we know today that there's no normal total PSA level. That men, what labs normally do is they give you a range of results. They say, well, if your result is between, for example, 0 and 4 nanograms per ml, that you're okay. But we know today there is no normal PSA, total PSA result, and we don't know why labs are continuing to put those ranges as normal levels, because there is no normal level. We know from recent research that if we stick to that plan of telling men that the result is between 0 and 4, it's normal, 26% of all men are going to miss a chance of being cured at diagnosis. So we need to get to be using more current guidelines, and the more current guidelines incorporate that blood result you had done, called the total PSA, as well as other factors. So, in response to your question whether 2 is a safe or normal result, I can't really say. I would have to say offhand that there is no normal result. So, we should be speaking to doctors about risk assessment as opposed to doing total PSA, blood tests.
All right, thank you very much.
Okay, sir.
Good evening.
Yeah, Dr. Cardone, it's going on, and I try to keep telling people that the real value of doing the total PSA test is if you're on treatment.
Well, I would say that in this case, what is important that the caller understands is that a result of 2 is a low result, but it doesn't mean he's healthy, unfortunately. The result just is low, but that does not exclude the possibility of having cancer.
Absolutely.
So, unfortunately, we can't say that he's healthy based on that result.
No. And
we also can't say he's unhealthy. We can't.
Well, we can't say either way because we know there is no normal total PSA result. Yeah. You're listening to 103 FM's Men's Healthcare Power. I'm Dennis Webster, and I'm with Dr. Flavio Cardone this evening. And we'll be going for a little short break right now. Don't turn that dial. We'll be right back. Welcome back, ladies and gentlemen. You're listening to 103 FM's Men's Healthcare Power. I'm Dennis Webster, and with me is the eminent Dr. Flavio Cardone. We're basically viewing a lot of men's health issues today: prostate cancer, non-cancerous enlargement of the prostate, so a little bit of information on ED as well as medical malpractice. If you have any questions about any particular health issues, feel free to give us a call here at 628-4103. You can also log on to 103fm.net, or you can send us a text at 4103. Yes, Dr. Cardone. So, we're still getting these questions about the total PSA. So I don't know what else we can do to actually bring about a change in that system, but keep basically letting the information out there that current guidelines, that's not how it's done.
Well, I think both doctors and patients should be educated about that, because I see very often doctors asking for the PSA test, even in men whose age completely discourages that kind of test. So So I think, the people who are more responsible for this are the doctors, because if they keep asking for a PSA test, any man who complains about any kind of urinary problem, they right away ask for a PSA test, even if, the man is 80 years old, in which case it's very likely the PSA will be elevated.
Absolutely.
Also, men are not given any information on what can elevate the PSA on its own. So, for instance, even riding a bicycle can elevate the PSA. And if nobody tells them not to ride a bicycle before taking the test, they might do that.
Absolutely.
So I think the most important thing would be to have the doctors learn something more about the PSA.
Also, reports state also that if you have your blood drawn for that PSA level within 72 hours of having intercourse, that the result could also be elevated.
Yes, there are several factors that can increase the PSA.
Absolutely. So, speak to your doctor about, this total PSA. Why are we still doing that as a screening tool? I'm lost. I don't know why. So we hope that changes. Any advice for men, for their doctors?
Well, I would say that for patients should try to find some good source of information on the PSA. There are several. And also try to find a doctor who knows about that. Yes.
Right. Yeah. So that's storing the total PSA. Also, when your PSA level is between 4 and 10, doctors generally ask you to have something called a free PSA level done. So what research has found is that if you take the result of the free PSA and you divide it by the total PSA, it gives you something called a PSA ratio. If that number is 10% or lower, it's usually a little red light that maybe some further investigation needs to be done. Normally, men who have elevated PSAs that are related to BPH have that ratio that's usually 25% or higher. So another test that's not been commonly done on the island is the free PSA test. And I mean, it's standard. When in my practice, I know it was standard when you had men with levels of 4 to 10. You want to rule out BPH, and you want to actually avoid a biopsy. So doctors, what they were doing when the PSA was elevated is they basically just sent you for, a biopsy to rule out prostate cancer. So other things weren't ruled out before, you basically had to go have a biopsy. So we're hoping that now with risk assessment, focusing more on the aggressive prostate cancers, that we'll be able to actually reduce the number of unnecessary biopsies that men have to go through. Because it's not an innocuous procedure. There's pain, there's discomfort, there's potential for infection, there's potential for bleeding. So you don't really want to have a biopsy unless it's absolutely necessary. So this is the kind of message we're trying to get out to men. And hopefully, if you don't understand, give us a call. Dr. Cardone.
Yes.
Anything to add to that?
No, you have explained it very well.
Right. So if your doctor is still sending you for the total PSA, maybe you'd like to have a discussion with him about risk assessment. I think it's important. It's the current guideline, and we need to, get up to pace with that.
Well, the problem is that very often in Trinidad, I don't know if any public hospital tests the free PSA.
The free PSA, no, it's difficult to find, and maybe it's something that the public hospitals, or we can get the government to incorporate into the public hospitals, is the free PSA test, because it does give you useful information.
Yes, but if people don't demand that, then they won't do it.
So people, demand, like speak to your MP, and get some changes happening. You're listening to 103 FM's Men's Health Clip Hour. I'm Dennis Webster. If you want to call us, we are at 628-4103. You can log on online at 103fm.net, or you can send us a text at 4103. I'm here with the eminent Dr. Flavio Cardone, and we are focusing on men's health.
Yes, and especially my colleague here, Dennis Webster, has a very good program for testing for estimating the risk assessment.
Yeah, we do risk assessments because, as I say, we don't want to have men have biopsies who don't need to have biopsies. A lot of men are going to die with prostate cancer rather than from prostate cancer, because we know prostate cancer in general is a very slow-growing disease. You probably die from something other than prostate cancer before that, but the aggressive type has a tendency to leave the prostate and spread to other parts of your body rather quickly. So those are the ones that we actually want to detect. So scientists are basically working on ways to develop new systems, to detect the aggressive types of prostate cancer. Now we know prostate cancer is it's higher in men of African and Caribbean descent, or in black men, I should say. So so if you fall into that category, then you should be checking, especially if you have a family history, a father or brother who's been diagnosed with prostate cancer.
Yes, that's true, but the testing again should be part of this risk assessment complex, and not just a PSA test won't say much. Will not exclude cancer and will not determine that you have cancer.
Right. So here we are, 103 FM's Men's Health Program. I'm Dennis Webster. We want to talk also about the standards of care, Dr. Cardone. What can people expect when they go to see the family doctor? Should you go to your family doctor with certain expectations? Some people I've talked to say, well, I go in there, no one's even listened to my chest, no one's taken my blood pressure. Is there a standard we should expect when we go to see your family doctor?
Well, I would say at least measuring the blood pressure and listening to the heart, listening to the chest. Those are basic things that should always happen.
Do you see a lot of review of medication? Like medication that people are on?
Again, in theory, I don't know what other doctors do, but of course one of the questions that should be asked is, what medication are you taking at the moment? And what medication are you actually taking is different than the medication which is in the patient history. Because sometimes it's written down, but maybe the patient is not taking it.
Right. And another problem I notice is we're having a difficult time getting morphine for pain medication on the island. Apparently we have no one's ever actually used Dilaudid on the island, which I use a lot in the palliative program we had in Canada. No things like oxycodone. Like, why are these drugs not available to people on the island? People who are actually suffering. A lot of them from cancer pain.
Well, I don't know why they're not available. I really have no information on the amount of whether they are available or not, but if they are not available, it would be very surprising here.
Right. So there's some changes we need to make. We want to improve the healthcare system. We are definitely, there are some areas, a lot of areas that we need to improve on, and we also need to create opportunities for local doctors to get the information that they need. We talked about continuing medical education, but what opportunities are created for them to actually obtain that?
Well, I think actually here not much, because they don't have so many conferences, they don't have so many events. After all, Trinidad is not Miami, is not Europe. But the doctors should try to find some way to maintain.
Are they difficult to establish? To have these programs, established and put in place?
Well, to have continuing medical education, you need to have some conferences, some targets, and you need to have doctors coming here to have the conferences. So that's not so easy, but still doctors can subscribe to journals, can read, can have courses. That would help too. Right.
Okay, lovely. So Dr. Cardone, I'd like to get into a bit of patient rights. You visit the hospital a lot of times. You're in a bed there. You're in distress. You're seeing people come in, different numbers of people coming in on a daily basis. I don't notice a lot of patients being basically introduced a lot to the care team. You have groups of people coming and to your bedside, and you don't know who is there, isn't it? Isn't it standard practice that you should know? Isn't a patient right that they know who's involved in their care?
Yes, of course, the patient should know who's coming to see them, and well, if this is what happens here, I'm surprised they don't. But this is something basic. You should know the name of the person who's coming to take care of them, also because you can, if anything goes wrong, you know who did something to you.
What about documentation? Have you noticed any areas in documentation that we can improve on?
Well, I think that having handwritten documentation is a big problem. It should be typed on a computer. It should be computerized. That would be a basic change here.
So a lot of what our systems right now can be made electronic.
Yes, that would be very helpful. Yes.
Right. You listen to 103 FM's Men's Health Care Hour. I'm Dennis Webster, and with me is Dr. Flavio Cardone. We're headed to a break right now, so don't turn that dial. We'll be right back. You're listening to the first and the finest. Welcome back, ladies and gentlemen. You're listening to 103 FM's Men's Health Care Hour. I'm Dennis Webster, and joining me today is the eminent Dr. Flavio Cardone, and we're discussing basically some men's health topics. Also, probably some things we can do to help improve the quality of healthcare, in Trinidad and Tobago. I think a big part of that is actually establishing some guidelines and some policies. It doesn't seem like there's a system that sort of everyone follows. For example, in Canada, we have Cancer Care Ontario, who actually establishes guidelines with regard to treatment of patients who have cancer. Now, it seems that the treatment we get in Trinidad really depends on where you go. No one actually follows one given system, and a system that's actually developed based on, years and years of research into clinical trials and what works best for people, dealing with cancer. So I think, a start, for our government will be looking at actually putting in a cancer agency that will monitor cancer activity, because right now not all agencies actually submit their data to the cancer registry, so we actually don't know the exact figures for cancer. So the figures that we do have, though, are quite high. Rates of cancer is going up and rates of mortality is going up, so we need to do something to actually rectify the situation.
And does this increase in rates of mortality and incidence, does it happen with what kinds of cancer especially?
But it seems like all of them, but a big one is prostate. Prostate is very high up. Another one is actually breast. I was speaking with a researcher, and we had some results actually coming out in the next month or two, showing that the rates of breast cancer, for example, are going down in other parts of the world and are going up in Trinidad and Tobago. So, we need to know, what's happening there. So that data will be coming out shortly. So I expect to have that, in the next month or so to share with you. But it's concerning. It's alarming. The number of cases is really alarming. So, something needs to change.
Well, yes, but of course you have to check why this is happening. You need to have the data. Without the data, you can't really do much. And
a lot of cases being caught at their more advanced stage. So we need to find out why that's happening, also. They did a survey in Tobago, the prostate survey in Tobago, that showed that we do have a high rate of prostate cancer, in this region. So, and unfortunately, like I say, if we use the present system, we're going to have a lot more men being diagnosed too late, basically, to get some help. So, let's get started on working on that.
Yes, as we have said, it is very important that that people pay attention to these things, and
Right.
especially doctors.
Right. So maybe some conferences or maybe some meetings to explain to doctors what the new guidelines are. Maybe that would be helpful.
Yes, that would be very helpful if something were to be organized to illustrate the newest guidelines. And for that, you wouldn't even need to have someone from abroad. Just need someone who is willing to do that here, to make a presentation on that. But also these things, they need some sponsor, because they have a cost. So if nobody's interested, then they don't happen.
Well, it's another thing we're hearing all the time is we don't have any money. The Ministry of Health doesn't have any money. There's no money to do all these programs. Well, I mean, there seems to be money for other things.
But generally conferences are sponsored by pharmaceutical companies, so the Ministry of Health wouldn't need to spend anything on that. In Europe, they are usually sponsored by various companies, and they don't have any public cost.
Now, you also mentioned, as far as the drugs go, that the drugs cost a lot less in Europe than they do in Trinidad and Tobago.
Yes, that's true. Generally, here they cost a few times more. I have found even sometimes 20 times more.
And there's no particular reason for that. Is it just...
No, I don't see why, because they could be imported from Europe, and I don't see why the same substance costs here 20 times more than in Europe. Some people, when you speak about this to some people, they will say, well, it's shipping, it's taxes, but even so, it wouldn't be 20 times. 20 times is 2,000% more, and there's no way taxes and shipping can increase something by 20 times.
Pretty significant, yeah. You listen to 103 FM's Men's Healthcare Power. I'm Dennis Webster with Dr. Flavio Cardone. If you have any questions, you can call in at 628-4103 or send us a text at 4103, or you can log in at 103fm.net. We're covering basically men's health topics today: prostate cancer, medications. If you have any questions regarding any particular health concern, Dr. Cardone is here to answer them for you. So give us a call. Dr. Cardone, I mean, there's only so much you can do with the prostate and prostate cancer. So I think we've actually basically put out the current guidelines on that. For BPH, and a lot of men are going to be experiencing those symptoms of BPH. There are things you can alter in your lifestyle to control that. If you're getting up a lot at night, one of the things you may want to do is reduce or cut back on the amount of fluids you're having before you go to bed, because as you sleep, your kidneys are still working. You may want to probably cut back also on things like alcohol. Alcohol is a diuretic. It's going to make you pass urine more, as well as caffeine. So you want to watch how much coffee you're having, and you probably don't want to have coffee too late at night before you go to bed.
Yes, because that will also disrupt your sleep pattern.
And how's the tea also, Dr. Cardone?
Tea is also diuretic.
Right, so that if you can cut back on that, you're probably going to get up less at night. And if that doesn't work, then you're probably having maybe some issues with BPH, and you should see a family doctor and get that checked. For men who don't like having the digital rectal examination, it's important that the doctor knows what the size of your prostate is, so he'll probably send you for a prostate ultrasound. You can have a regular abdominal ultrasound that will show the prostate, or you can have a transrectal ultrasound that's a more accurate a way of assessing the size of your prostate. Now, as I said, some men will have enlarged prostates and will have no issues with urination. So because you have a large prostate doesn't mean you're going to have problems with urination.
Yes, in fact, you should only treat benign prostatic hyperplasia when it actually causes some symptoms.
Right. And the AUA, which is the American Neurological Association, has actually guidelines, for doctors, to help doctors in deciding who needs to be treated and who doesn't.
Yes, they basically use questions similar to the IPSS.
Right, right. And as far as the drugs go, Dr. Cardone, you said you did some... tell us a little bit about the drugs that they're using now for the BPH.
Well, the drugs are to be used only if needed, not right away. And we see that lots of times people are given drugs immediately without trying to have first behavioral modifications. Mm-hmm. Usually the drugs are alpha-1 adrenergic antagonists, such as tamsulosin, terazosin, and those work very well. And let's say the main side effect is that they can lower the blood pressure too much, and that's one thing to watch for. Otherwise, and they also work very quickly. Patients who do not respond to those, they can take other kinds of medicine, and those are called 5-alpha reductase inhibitors. Those also work, but then the patient should know that they take a few months to start working, sometimes even a year. Right. And the patient should try to keep taking that medication even during that whole year and not interrupt it thinking it's not working.
So they should take it for the full year. So now the another side effect of the alpha blocker, that's the Flomax and the terazosin, and I think it's you see it more commonly in men who've been on it for a while, is what we call retrograde ejaculation. So what happens is instead of the semen going forward, it goes back into the bladder. So some men have expressed some concern, about the reduced amount of ejaculate, and that one of the side effects of the alpha blocker is the retrograde ejaculation. So you will see a reduction in semen production. So don't be too alarmed by that.
Yes, that doesn't happen with all of them. Mm-hmm. It happens usually with the ones available in Trinidad, the tamsulosin.
The Flomax, right? Yeah.
But the other ones have that effect much less. And in fact, terazosin is on CDAP, so patients can get it for free in Trinidad.
Right, and that drug also needs to be titrated. I've had actually emails from men who've started on high doses. Terazosin is, usually started at a small dose and gradually worked up.
Yes, of course, the patient should get the medication in the dosage that he needs, not just any dosage.
Great. So that's BPH. I think that pretty well covers it. I'd also like to bring your attention to the fact that there is a blog that has all this information available. I've set one up, and you can access the blog by typing in Helpatrini. That's HELPATRINI.wordpress. That's WORDPRESS.com. And there I have a lot of information on BPH, prostate cancer, erectile dysfunction, and a lot of topics regarding men's health. So feel free to visit and leave comments if you have any with regard to the content. Dr. Cardone, high blood pressure. Anything else you want to add for high blood pressure? We talked about diabetes.
Well, men have very often problems with high blood pressure. This is, of course, they should reduce their salt intake. They should also avoid fatty foods. And
that's going to be kind of difficult in Trinidad with all the barbecues and... Yes,
and especially high blood pressure, one of the main problems, of course, is that it doesn't hurt. So people can think that high blood pressure is not causing them any trouble, But the moment high blood pressure starts to cause symptoms, generally it's much too late to do anything about
it. So the main things that people are risking are just heart attack, stroke.
Yes, heart attacks and strokes. Those are the main, the biggest problems of hypertension.
So diet. There was some mention also about obesity. There's some new data came out that says that obesity, a lot of it is related to the fat hormone called leptin. So
leptin is actually hormone that signifies that you have already eaten to your satisfaction. So it's not exactly a fat hormone. It's a hormone that tells your brain you have eaten enough. So some people have postulated that if you have a dysfunction with leptin, it can make you eat more than you should. But it's not. You can't blame it all on leptin, because if somebody eats too much because they like eating and they don't exercise, then leptin doesn't have any influence on that. The main things people should do is watch their diet and exercise.
Okay, so let's watch your diet, watch your salt intake, watch your saturated fat intake. Try and what about the body mass index? Should people be paying attention to the body mass index?
Yes, that is also another indicator of whether they are overweight or not.
Right. It's a very difficult thing, though, Dr. Cardone. And you hear about all these diets and, people trying to get on these diets to lose weight. You get on these crash diets, you lose all this weight, and then all of a sudden it's back on.
Well, actually, losing weight is, in a way, simple. You just need to eat less and exercise more. And there's no special trick or special diet to lose weight. These crash diets only make people lose water, and that's why the weight falls down, because
and actually gets them into trouble a lot of times. Huh?
Yes. Some of these diets are actually quite dangerous.
Right. So be careful. Consult your doctor if you're considering any crash diets. Speak to a nutritionist. Don't try and do any of these crash diets. More and more research is coming out saying that they don't work. So, pay attention to that and speak to your doctor. Hopefully he'll have some good information and good advice for you. Dr. Cardone, we are kind of coming to the end of our show today. Would you like to, I know you're leaving and for a little while. We hope that you're coming back. But do you have any parting advice for the citizens?
Well, I would say, we spoke during the past weeks on medical malpractice, on men's health. We spoke about several topics. I don't have any special advice before I leave. I would say, try to be informed, try to know as much as you can, and try to get it from good sources, especially not other patients, and not just anything on the internet.
Right. So be very careful. Ask questions. That your doctor, he's supposed to. He's the one there to actually, to guide you. So if there's anything that's not clear to you, ask questions. You have to build up a relationship with him where you feel confident that your care is in good hands. So this is 103 FM's Men's Healthcare Power. I'm Dennis Webster. We're here with Dr. Flavio Cardone, who's going to be leaving us tonight. He's going to be heading back to Poland. And it's been great having him on the show. He's been giving us some really great advice on good how to move ahead and improve our healthcare system. And I hope after tonight that we do make those strides in the right direction. Dr. Cardone, thank you.
No, thank you too.
When you come back to Trinidad, we hope that you come by the station again and again be our guest. We're just gonna, if you have any questions, we're gonna be closing up the show in about the next 5 minutes. You can give us a call at 628-4103, or you can log on at 103fm.net, or you can send us a text at 4103. Sounds like we have, quite a bit of work to do, but I'm sure we can get it done. It's not going to happen overnight, but I'm sure, we can make the changes that are necessary to improve our system. So, on that, ladies and gentlemen, we'll see you next Tuesday, same time, same channel, and good night and God bless.
And goodbye, Trinidad, once again.